A lot of adults are looking to straighten their teeth as now they've gotten older and see things have moved. Maybe they didn't have braces when they were younger, or they did and maybe things have moved since then. Braces are an option for them, and so is Invisalign. They're both just two different ways of putting forces on the teeth to move them in the direction we want them to go. Some of the advantages, Invisalign, obviously you take them out so that you can take them out to eat and brush so they don't impede what you want to eat, any kind of thing like that. Also, brushing and flossing, which gets really important as you get older. That does tend to make that much simpler, and so a lot easier process for people. So when somebody comes in for their initial exam, which we call their new patient exam, they'll come in, we'll go over the medical history, any other sort of problems they might be having, what their chief complaint is. But a lot of times the big thing we're looking at is you look at their teeth and just how much space do they have, and then how do the upper and lower teeth fit together? Whether they have more of an overbite or an underbite, and those kind of things then start to put together for you what you're gonna have to do to fix it. We really like to have patients come in when they're younger because we can get an idea of what's developing. We want to make sure there's nothing about their teeth that's destructive. The way the teeth are wearing against each other is going to cause a problem to be greater as time goes on. A lot of times if there's little things we can do that may not even really involve braces, but to kind of help stuff come in better. But then as you look at all that, you just want to see how things are developing and just when is going to be the best time for them to get started to kind of minimize their amount of time in braces and still be able to accomplish all the goals that you want to set for them. So if you have questions about how your teeth are lined up, or about for your child, how their teeth are developing and is braces something they might need, the best thing to do is just call us. We'll get you in, take pictures, x-rays, do a real thorough exam, look at all that stuff and kind of really sit down and put some thought into it and figure out what the best timeline is and treatment plan might be for you. And those kind of things really is a large part of what our job is taking the time to make sure that we, for each patient, kind of have an individualized treatment plan for them.